we'd expect that if therapy is successful, that over that period of time, this person is better able to manage their anxiety, that the worries aren't as excessive, better able to control those worries. Anxiety is not something that we want to avoid. Welcome to Be Kind to Your Mind, a podcast brought to you by People Psychological Solutions. We all worry, but when worry spirals, it can take over our lives. Today, we are going to unpack Generalized Anxiety Disorder, better known as GAD, what it is, how it works, and why it's more than just overthinking. We will explore the psychology behind chronic worry, discuss treatment options, and share helpful ways to better manage anxiety in everyday life. If your mind often races with what ifs, or if you support someone with high anxiety, you'll want to listen to it. To unpack all this, I'm joined here today with Kwan Jie, clinical psychologist here at People. Kwan Jie is a clinician who has worked extensively with clients with GAD, or generally clients who can be highly anxious or tend to be worriers. Welcome to the show. To begin this, let's begin with the facts. So when we think of anxiety, what is that exactly? And how can it differ from stress or even worries?
I think a lot of times people use these three terms like interchangeably: stress, anxiety, and worry. However, they are actually very different things. So let me start with worry. Worry is actually the thinking part of anxiety. So worries are thoughts. They can look like: have I said something wrong? Is he or she mad at me? Am I a failure? Well, that's worry. And with stress, stress is actually a physiological response. So it happens within our body when our body perceives a threat. So our hormone levels, like our adrenaline or cortisol level, they change and they prepare us into a fight and flight mode. This is what we call stress. As for anxiety, it's more like the intersection between those two. Anxiety is the feeling as a result of those worries and the physiological response. Now, this often feels like an impending doom or like a sense of dread that never goes away.
Okay, so you have described what stress, anxiety, and worry is. In general, worry is a cognitive process, the act of thinking about something uh, that is to happen in the future.
Most of the time, when it's related to anxiety, it is something that has to do with the future, something unpredictable.
Yeah, so worrying tends to be future oriented. I worry something might happen, or what if it doesn't work out, or whatever that worry might be. And as a result, it comes in the form of anxiety. So that is the emotional experience of the individual who is worrying. So worry and anxiety, these two are, one is a thinking process, one is an emotional process, but one cannot exist without the other.
That is true. I think when there's worry, a lot of time there's anxiety. And then with more anxiety, a lot of time what we see is that there's more worry as well. So it sort of goes like a cycle.
Okay. And then there's stress. So from my understanding, stress oftentimes is a response that is activated by an external event. Say, for example, there is an important presentation tomorrow. So as a result, that is a stressful event, and that puts me in what you say is a fight or flight mode, fight or flight response. The body is deciding whether it should fight out that threatening event or it should run away from the threatening event. Regardless if you choose to attempt the presentation or to just call in sick, the body is responding in a very specific way because of all the stress hormones that are secreted in the body.
So normally what you will experience are, let's say, racing heartbeat. You might feel dizzy, you have headaches. Some people might experience cold sweats or difficulty breathing. These are all what we call stress response.
In a very mutually exclusive understanding of stress and anxiety, we can see that these two are different experiences altogether. So stress changes how the body feels based on something that's going to happen. Anxiety, on the other hand, is activated because I'm thinking about something that is going to happen in the future. Whether it's realistic or not is a different matter. But regardless, as long as I'm worrying, I have a feeling of anxiety that accompanies it. It can be mutually exclusive, but at the same time, stress and anxiety and worries, they all also share similarities or they overlap. For example, going back to that presentation example, I can have an important presentation tomorrow, and that is a stressful event. I experience fight or flight activation. My body feels irritable, I'm restless, palpitations, and so on. But different people might experience the level of stress differently. Some people can be highly stressed. Some people can be stressed at maybe an appropriate range. Some people might not even be stressed at all about that stressful event, supposedly. For a lot of people, it's an important presentation. If I don't do well, I might lose a job, let's say. But some people might not even be bothered. And this all also stems from, I suppose, some of the things that we'll be discussing in a while. Some of the factors that might predispose us to perhaps worrying more about events compared to others. But in this case, a stressful event can be made more stressful if, for example, we are more of a worrying type of person. So instead of thinking about the next day's presentation, how can I better prepare for it, feeling a little bit uneasy, excited, I might be worrying about the most catastrophic outcomes of the presentation. I might be worried about what others are thinking of me, that I'll act as a fool, so on and so forth. I'll fail miserably. And those are the kind of worries that will exacerbate or will make the stress even worse. So, although stress and anxiety can be viewed as mutually exclusive, but when we think about stressful events, there can actually be overlap because we do worry, but to what extent actually worry becomes problematic, it adds to the problem. And this comes my follow up question, in which what actually makes a person considered to be someone who might require professional support when it comes to managing their worries or anxiety. Because I think, just between me and you, we likely have engaged in worry and have felt anxious every day or at some point in our lives. What At what point does it come?
Become unhealthy.
Yeah.
Okay. So a healthy level and unhealthy level of worrying. So you can expect someone with a healthy level of anxiety or worrying. Their stress, their anxiety tends to be more situational. For example, using your example just now, the presentation, they might feel the anxiety the night before the presentation, but often the time what they notice is that after the presentation, that sense of anxiety or that stressful feeling, they go away. So they don't stay. So, but with the unhealthy level of worrying, what we normally notice is that their worries become chronic, they become very excessive, and they're very uncontrollable. So chronic as it happens most of the time. So if you're either you're worrying about this or you're worrying about another thing. That's what we call it, like a wide range of different things that you're worrying about. And uncontrollable as in no matter how irrational that your thoughts are, you can't push them away. They just keep coming and coming. And normally these are what we feel cognitively. And then emotionally, the feeling of doom, foreboding that we talked about just now. And then physically, you would feel the sweaty palms, the difficulty breathing, racing heartbeat all the time. And all these added together, they start affecting your daily functioning. It can be your social functioning, for example. They make you less present when you're with your friends. You feel very isolated internally. They start affecting your work because the anxiety is so great that you can no longer focus on your work. So this is how I would differentiate whether it's a healthy or unhealthy level of anxiety.
So based on the explanation, it does sound like, again, and that's how we function as psychologists. We have the DSM, which is a manual that we follow in terms of for diagnostic reasons. And oftentimes they are categorical. So what I described there is that if someone is worrying, even past the stressful event, there are no specific events that the person is worrying about, but rather it is an ongoing, uncontrollable, excessive amount of worrying that leads to them being unable to function effectively in their relationships, in work, or in managing their self. Then it becomes uh, a cause for concern, where this person likely requires professional support.
Yes.
And uh, in terms of the mental health definition of this particular concern, this is what we call generalized anxiety disorder. And the term generalized anxiety comes from the feeling of anxiety that is generalized. It means that it does not discriminate between event A or event B. It's as if the mind needs to latch on to the next thing to worry about. So I might be worried about the presentation tomorrow, but once the presentation is done, I'm going to worry about the next thing.
Like your marks
Yeah.
and how your teacher would perceive you.
And with generalized anxiety, it's not going to be domain specific, right? So the presentation could be a university event, but then my next worry could be about relationships, or the following worry could be about finances. But the mind is as if it's on a marathon all the time. It's constantly running from one worry to the other.
Yes.
Which means that if I were to sum up our discussion so far, worrying, anxiety, and stress, these are all part and parcel of everyday life. But when it becomes excessive worries and when it does not seem to stop at specific, perhaps very important or meaningful event, uh, difficult to control. And that when it affects our day-to-day functioning, that is when likely professional support will be indicated versus someone who might worry here and there, might feel stressed or anxious. That will be I think, the differentiating factor here.
Yeah.
So to assist the audience back home to better understand why there is this difference between the chronic worrier versus everyday life individual worrier. Yeah,
Moderate warrior.
moderate or a light worrier. Um, what are some factors that that you think contributes to a person developing this sort of generalized anxiety pattern of worrying?
For my experience working with those who struggle with generalized anxiety, a big factor that I notice is their family environment and generally their upbringing. So I see often parents who are unpredictable, parents who are temperamental tend to raise kids who have anxiety. And that is one because a lot of time kids who grew up in such environment, they learned how to walk on eggshells all the time. It's always a crisis mode for them. They need to think whether it's right for me to say this, it's right for me to do this or that, so that my parents don't get angry. So this, when it transitions into adulthood, they adopt this as a coping strategy into their daily life. And not just with uh, parents who are temperamental, we see that parents who are anxious and over controlling towards their kids, they tend to raise kids who are bigger warrior as well. And why is that? Because parents who are anxious, they tend to control their kids, what the kids do, what the kids where the kids go and what do they say. And when they are doing this, they are actually taking away the kids' opportunities to be exposed to daily challenges, uh, to life generally. And when they don't get exposed to these things, they don't learn how to cope with these things. And when they grow up, they become very fearful of everyday tasks. So that is with family and upbringing. A lot of times trauma can change someone as well, especially with unresolved trauma. They have this um, constant fear of things going wrong. They have this belief that the world is no longer safe, and that puts them on hyper vigilance all the time. And they feel that they need to watch out so that they don't get harmed again in the future. And that's with trauma. But I also noticed that people who have low self confidence to begin with, they are normally big worrier as well. There's a pattern that I see with this group of people. They tend to overestimate the severity of an outcome. They catastrophize a lot. And not only do they overestimate that, they a lot of time underestimate their capability to deal with an outcome as well. And these two together make life very difficult for them because everything is too much for them. And we notice that with people who have perfectionistic tendency, a strong need for control, and they can't bear making mistakes. These are times when you will notice that they become very anxious. They try their best to make sure everything goes their way, goes wrong. These are the patterns that I see with clients who struggle with GAD.
Okay, so you've brought up several points, risk factors with regards to the development of GAD. And the first 2 points is related to the family environment. So if they are in an early environment where it's overly controlling, or in an early environment where it's overly unpredictable. And as a result, there are deficits in either one. For example, there could be deficits in skills because uh, if I'm always in a controlled environment, I'm unable to develop the skills of actually managing that level of control on my own. As a result, they go into adulthood not having the skills because all that order and control has already been set on them earlier on in life. So if something don't go according to plan, for example, then what do I do?
They're not equipped with that.
Yeah,
Yes.
yeah. So as a result, then they might be engaging in these excessive worries as a way to cope with a world that is not organized and controlled as before. Alternatively, there is I suppose, the chaotic environment, and you use the term walking on eggshells. So if what I'm doing, I don't know what can be the consequence, I'm unable to develop a worldview that is predictable. I don't know if I perform action A or B, is that the right action or not with regards to getting the outcome that I want. So again, moving on into the adult world, I might then worry about what should I be saying next. Is this going to upset the person, or the alternative question or the statement might be a better one.
This type of people, we often see that they overplan a lot. They think and plan. That's all they do every day.
I think you also brought up about trauma, and I think um, in this case, in our work there is this term called a differential diagnosis, where we want to differentiate between different conditions. Oftentimes, with a trauma response, when you mention hypervigilance, it's oftentimes linked to certain pathologies like PTSD, for example. And when I mention about overthinking about what another person might feel, that's a more specific kind of anxiety called social anxiety. But with regards to generalized anxiety, it still makes sense if, for example, that person has uncontrollable and excessive worries over a variety of different things. So with trauma, if it doesn't fit into the sort of the realm of PTSD, I can see also why that might aggravate the act of worrying because something has happened in the past, and I am trying uh, to ensure that it doesn't happen again. That's a kind of a
That
trauma response,
that
right?
can be one. Or I think sometimes it's because the body is or the brain is unable to differentiate whether you're actually out of that dangerous situation. A lot of times you may actually think that it's still happening to you. And we see that with people with PTSD and like with flashbacks being the intrusive memories. I think that could be another reason as well.
Sure. So it can be a matter of trying to exert control over perhaps an event that where they might lack that control, or alternatively, because the physiological response is still heightened. And I like to provide a counterpoint here with regards to what you have shared in terms of risk factors, because they seem to be more psychological or environmental. Early childhood upbringing, um, certain traumatic events, for example. But what would also increase the risk will be a predisposition. So, a family history or genetic factors that also increase the risk of a person being overly of a worrier. For example, if I am in an early family environment where it is very controlling, so my parents then demonstrate the same kind of qualities that in later on in life I would also develop. Could there be some kind of anxious predisposition within, my parents or perhaps the grandparents, some intergenerational passed on trait that increases the risk of me actually being overly anxious and worried as an individual? Quite likely there's going to be evidence there as well when we observe, for example, in the twin studies, there is a genetic risk factor here that increases the rates of this being passed down in the family. Mm.
I agree with that. I think it's definite. The genetic definitely plays a part in with how vulnerable someone is to developing GAD later in their lives. But to counter your counterpoint, I actually think it's always as much genetics as it is environment. So you talked about the generational predisposition just now, like the pattern that we often see with our clients and their parents and their grandparents. We don't only see a pattern. And a lot of time people jump to conclusion to that and say that it's because there's genes in that family. But I think what a lot of people oftentimes fail to take into consideration is that if now gene can be one thing, but that environment is also the same for
Mm.
three generations.
Yeah.
So it could not be genetics, but I think genetic is not enough to trigger generalized anxiety when we enter adulthood. Like a genes need to meet with a correct environment for it to be activated.
Yeah, yeah. And hence why, in understanding mental health at this time, the best model that we adhere to will be the biopsychosocial model. It's oftentimes a combination of certain genetic predispositions, family history, but also psychological and environmental factors, the things that we shared about just now. Sometimes it can be quite difficult to completely eliminate all other factors and purely attribute the reason to an environmental or a genetic basis, because oftentimes there's an interplay between all of these factors.
I believe they're closely associated with each other.
Mhm. So, for example, in the twin studies, you could actually see that twins that are separated at birth, for example, different environments might still demonstrate the same kind of pathology or issues. Or
But we could argue that and say because if twins are given up after birth, that means there's something wrong with the dynamic of the family already. That means there's already stress, like what we call prenatal
Mhm.
stress during pregnancy. There's a lot of maternal stress that could have affected the development or the predisposition of the child already. Mm.
Yeah. So at the end of the day, I think likely there's going to be effect sizes of different factors that individual A might have, for example, a stronger genetic link to certain issues, such as generalized anxiety, while individual B might have very strong protective factors, no genetic links whatsoever to generalized anxiety, but somehow along the way, due to a variety of environmental and psychological stresses, had resulted in also the development of the disorder. So biopsychosocial factors, but regardless of whatever factors and risk factors that a person might have, different people might be predisposed to different factors. Um, let's just assume an environment where you are meeting clients, meeting diagnostic criteria for generalized anxiety. Uh, Different people, different backgrounds, yet they find themselves being excessively worried, unable to control the worry, and as a result, they aren't able to function in day-to-day life. What are some common themes that although they're different people, by the way, but yet somehow I think through our clinical practice, we can actually see some commonalities between them. What are some common themes or common factors that you notice among individuals who are diagnosed with GAD?
I mean, the things that they worry about was the common thing here.
Yeah, it could be common worries, it could be common characteristics. What are you noticing?
They are separated into two parts, like common characteristics and common themes. Let's talk about the characteristics first. So one is definitely what I said just now, the overestimating an outcome and underestimating their capability. I would say everyone, almost everyone with generalized anxiety disorder, they have that. And the second one would be, this is very, very common as well. A lot of people with generalized anxiety, they actually believe that they need to be to worry so much. They believe that this generalized anxiety is helping them becoming better. It's a tool that is necessary if they wish to become better, or if they wish to achieve anything in their life. And a lot of time when we question them, the
Their worries are
beneficial, how logical their thoughts are in this session, they would actually tell us that this is what is making me better. I need them. But they often fail to notice that this is not the sustainable way for them to achieve something. And third would be, everyone with generalized anxiety disorder, they have deep fear towards uncertainty and they need control. So they struggle when there's uncertainty, but they feed onto control. So they try to do everything they can to make sure everything is in place. So these are what I notice with this population.
So you've mentioned 3 points.
Mm.
Underestimating abilities of the self, but it pairs together with thinking of the worst of what's to happen. Secondly, is that the act of worrying actually is something that they think is helpful for them, whether I think consciously or or not unconscious. That's a whole different area of psychology. Whether consciously or not aware of such a belief system. And thirdly, is because tying back to early experiences, if throughout time they have been in an unpredictable sort of reality, that this is a way for them to exert control. I worry because I want to be sure. I want things to be, my ducks are in a line. So these are some of the characteristics that you are noticing. And I think these are the characteristics that maintains the disorder as well. So long as I maintain this way of thinking where I don't think I can match the sort of the outcomes that I need, or I always think of the worst that could potentially happen, quite likely the anxiety will remain. And the same goes with attempting to worry about every single thing so that things remain in control, or at least that's how I feel. Right? I feel in control, or that I need to maintain this act of worrying just so I feel productive. It serves a positive value to me. So long as these three processes, maybe some clients might demonstrate one over the other, but so long as these are being maintained, it's quite likely we expect that the GAD would also maintain. Which brings me to my next question, actually, because if we are identifying that there's these sort of three different areas that we could address as clinicians, how do we actually attempt to treat the GAD or provide some kind of intervention so that the worries become less excessive, that the worries become more controllable, they can achieve a better quality of life?
So with treatment, there are different ways we can penetrate into this whole situation. A very common one that we do in therapy would be what we call cognitive restructuring. As I say, just a lot of anxiety, they're caused by worries, and we would notice that these worries are oftentimes non-beneficial, they're not helpful, they're causing more harm than giving you more benefits. So we would sit down with clients to pinpoint these thoughts and try to reframe them into more adaptive ones so that their anxiety level decreases. That is one way. And when we talk about anxiety, anxiety is a secondary emotion to fear. And when we talk about fear, to overcome fear, we often employ something called exposure therapy. So people with anxiety, they always avoid doing a lot of things. For example, someone with social anxiety, they avoid talking to people, they isolate themselves. Someone with driving anxiety, they never want to drive, they don't want to be on the road. And how exposure would look like in therapy is we get them started with exposing them to the things that they are afraid of, but oftentimes in a gradual level. For example, with the driving anxiety, you could start with 1 kilometers per day of driving or with company. And with social anxiety, you could start with talking to one person per week. And slowly we move on to higher levels of exposure. And we notice as we move on, only the anxiety level decreases as well. And problem solving is also another thing that we do. We talk about how people with anxiety, they underestimate their ability to overcome something, right? We would build problem solving skills together with clients so that they know that they actually have the skills to solve whatever challenges or hurdles that life gives them. And oh, and additionally, relaxation techniques help as well a lot of times because when the stress response is being activated, it's very hard for you to concentrate on daily tasks with the headache, with the difficulty breathing. Like deep relaxation techniques, then, such as deep breathing, progressive muscle relaxation, could be very beneficial. I call them this temporary solution to anxiety, just to manage your anxiety level so that at least you can go on with your life.
And I think to put an image to what you've just shared, if I could liken it to worries being like a very close buddy of mine. So let's say I am an excessive worrier. The act of worrying excessively is like my best friend lah, that's never left me. So if I were to remove this best friend altogether, I wouldn't be able to cope or continue living. I just don't know how to actually do it. So when you mention about doing exposure, for example, it's the act of actually doing something in order to test out certain assumptions that I have. And as a result, over repeated times, I may realize that certain assumptions that I have actually isn't true. So in the case of the this analogy, still going with it with the best friend, my therapist might attempt to maybe have a timeout away from my best friend for me to do some alternative activity. And over a period of time, I realized, hey, actually, without actually having this best friend here, life still can go on. And as a result, then I develop more flexibility in terms of the actions that I can take. I may, in the long term, no longer avoid certain situations, avoid public spaces, or avoid driving, so on and so forth. Because over a period of time, I've experimented with that behavior. Turns out nothing bad happens. So my beliefs and ideas about that actually changes. There's no harm in actually doing this. Whatever thoughts I have about it in the past, not really as true as I thought it was. With the analogy once more with the best friend, because the worrying is as if it is a very a convenient tool that I have. It is a tool that I know very well. If I were to remove it altogether, I don't know how to organize my world. If my world has been very chaotic, worry was the solution to it. And that's where I think the exercises of developing alternative skills in the way that we think is going to be helpful, where we want to develop new ways of thinking or to be introduced new tools where you could think in a way where you don't have to excessively worry and yet still able to function. So the goal here is not so much about removing their best friend altogether. I think it's going to be highly traumatic for that person wouldn't be able to function, but it's more of maybe taking momentary breaks away from that best friend to try out certain activities and behaviors and to see if it's really necessary or not, or even to be offered alternative friends for the sake of this analogy, uh, and to see if those friends actually uh, are giving you a good time or not. So from there, I think over time, the person develops more flexibility and doesn't exclusively just rely on this one friend of his in order to go through day-to-day life. There's really a variety of other things that I can do, a variety of other skills that I can use in order to live life. And as a result, then I wouldn't need to actually worry as much.
I think on the removing the best friend, we need to clarify one thing, which is that it's impossible because if we, my understanding is that the best friend is the anxiety.
Yes,
It's really over
yes.
frantic friend that it's always there, and we can nobody can ever remove that best friend or anxiety. In fact, that might actually make things worse. The more you try to push something away, the more that your mind would actually wants to pay attention to that. So I think a better way out of this is to accept that your best friend will always be there and try to make peace with that best friend, doing the things that aligned with your values while having the best friend there. Because oftentimes what we notice when we do this is that as you stop giving that much attention to the best friend actually calms down for a bit. The anxiety is still there, but it's not as frantic anymore. And then it gives you better capability to focus on what you want in life.
Perhaps a better analogy here is not so much of a best friend, but maybe a family member, and how close we are to that family member can actually be adjusted. But in terms of a familial bond, due to a shared bloodline, is not something that can be separated altogether. Because early on in our discussion, we talked about stressful events and how we might worry, but some people excessively worry. So over here, in terms of that analogy of being very close with someone, is the idea that I can develop that flexibility there. Sometimes I can go hang out with other people, and that's fine too. For specific events, I'm going to hang out with this worry,
Yes.
and that's fine as well.
Because sometimes that hanging out with this friend is necessary. For
Yeah,
but
yeah, we need to
you were to
worry.
worry about your interview, your presentations.
Yeah.
You prepare and
Mhm.
you do well. Yes.
So worry has potential benefits as well if this particular tool is used effectively. So that's how therapy can actually be helpful for the individual, and I think this one will be done in a more, I suppose, structured manner where you have successful consultations with therapists. The therapist can identify some of the factors that we discussed today. Perhaps based on your upbringing, so on and so forth. And these are some of the reasons why that excessive worrying is happening, and what are some of the ways to which we could learn to better manage this. It happens in an ongoing session by session basis. And we'd expect that if therapy is successful, that over that period of time, this person is better able to manage their anxiety, that the worries aren't as excessive, better able to control those worries, and they might feel more present in their relationships, work, and so on. That will be a positive outcome for therapy, especially if someone has GAD as a disorder. But those listening in, they might not be at the range where they require clinical attention, or maybe they are. there's likely going to be some practical steps that can be taken even without a psychologist attending to them. To close out our session today, perhaps we can provide some insights to the audience as to what are some practical steps that they can take on their own or maybe with their family and friends in order to better manage their anxiety and worries.
I think the best way to deal with anxiety, I mean, it's definitely not removing it like by distracting yourself. That wouldn't work. The best way would be to do the things that you feel anxious about while having those anxiety. Because the more you do it, you will realize that the anxiety will slowly go down. So this doesn't only have to happen in therapy. You could do that on your own. If public speaking is what you feel anxious about, then start small with, let's say, 3 to 5 people, and then slowly expanding into 10 to 15 people. As you do this, you will realize there will be anxiety, but that is the point. You do that with the anxiety, and you will notice that it goes away eventually.
I think what you're sharing here is fundamentally anxiety is not something that we want to avoid. It's not something that we want to avoid, we want to deny, or we want to suppress. We'd like to recognize that anxiety is going to be a natural consequence to certain actions or events. And we could treat this anxiety not so much of a best friend, lah, like a family member, lah. But we don't have to hold on to them so tightly or to ensure they stick to us all the time. But yet we recognize, yes, this person is a family member. So when I'm going out doing something, I am going to be anxious. And that is a usual part of life that I'm going to learn to better accept and acknowledge. That can be done through more conscious effort of scheduling in activities, I suppose. That's one way to go about it. Earlier on, you mentioned something along the lines of values and whatnot. I think there's a more mindful approach to it where individual may want to intentionally be present with the anxiety just to better understand how it feels like and to welcome it a little bit more, and then that feeling actually becomes less scary. That can happen in the context of therapy as well, the practical step that you just shared, as well as with the mindfulness approach. But I'd also like to chip in. I think one very practical step, because you've mentioned relaxation earlier, is because anxiety is something that makes the body react in a certain way as well. And if we engage in regular physical exercise, it allows the body to also regulate these feelings because you're using up the sort of the excess glucose in your bloodstream. You are tiring out yourself, utilizing the muscles that tend to contract when you're feeling highly stressed or anxious, and this allows the body to self-regulate in terms of managing that anxiety. You'd find that people who are physically active are better able to manage their anxiety and levels of stress as compared to a person who might be living a sedentary lifestyle. So having, I think, some movement, sports, and whatnot at the recommended amounts on a weekly basis likely is going to help.
Going back to my point just now, why exposure works so well is because as you expose yourself to these things that you fear, you actually increase mastery towards these things, and along the way you increase your confidence. And I think in therapy, a lot of time what we work on is actually increasing the client's confidence, their self-esteem, so that they have more courage to deal with uh, everyday events, and hence the anxiety will reduce.
Yeah, because earlier on you also mentioned about how they may tend to underestimate their abilities or overestimate the negative outcomes that they think will happen. So in the context of actually trying out the behavior, they might realize, hey, actually I'm better at it than I thought I was. Or that they actually see that turns out it's not as bad as I thought it would be. Uh, Exposure actually can happen in the context of therapy as well, especially if there's certain anxieties that tend to be more specific to very specific events, what we know as phobias. But I suppose that's something that we could discuss on another segment. So Kwan Jie, I think we have covered what we need to cover as part of our episode today. I hope that the audience back home could benefit with some of our points that we've raised during our conversation. And thank you for coming to the show.
Thank you for having me.
Thank you for tuning in to this episode of Be Kind to Your Mind. Found this content educational? Hit the subscribe button to stay updated on new episodes every 2 weeks. See you soon.